A knee replacement is a device that replaces the surfaces, the joint surfaces of the knee. There are different types of knee replacements. Some of them substitute for ligaments if you need that. Essentially what we do, and here's a model of a total knee, is we make an incision, flip the kneecap over and flex it. And then now you see this is a model of a knee replacement. The femur is like that and restores the native contours of the end of the bone. This is actually one where the posterior cruciate ligament is substituted, and that's what that post does. Okay? This is a titanium base plate with a polyethylene joint surface, and it goes on the top of the tibia, which has been cut flat. And that's essentially the normal contour of the original tibia plus a post. The femur, because we're taking out the posterior cruciate ligament on this one, has a cam right there, and it slides over the end of the femur like that. And then when you put it together, it then allows the knee to roll like this. The back of the kneecap is also replaced with a plastic button that replaces about 1/3 of the natural kneecap. This one is a ceramicized metal. That's a proprietary thing from one of the companies. Most of them are cobalt chrome. The patella is polyethylene, and then the joint surface or the bearing of the tibia is a high-density polyethylene. The typical patient that comes in thinking about knee replacement has had pain for a while, and sometimes some deformity, meaning the knee has become more bow-legged or more knock-kneed. Sometimes the knee will actually not straighten all the way, or it'll lose some of its bend, flexion. The things that drive people toward knee replacement, well, first off, what can you do to treat regular arthritis before getting to knee replacement? The things that we typically do are occasionally give anti-inflammatories, that we don't like giving them all the time because we worry about hurting people's kidneys and livers. We do steroid injections occasionally, and we also use hyaluronic acid injections. There are people who use things like PRP and stem cells. Those are a little more experimental. The main thing that people can do is weight loss and use of some sort of repetitive motion exercise with minimal stress on the knee. That means an exercise bicycle. They ought to do it 3 times a week and do it religiously. Sometimes an elliptical will work, swimming will work. Things like stair steppers, squats, lunges, those are all very bad for knees that are arthritic. The reasons a person comes to knee replacement usually is pain. Pain is when a person starts losing sleep, that's one very bad thing. When a person has pain that limits their ability to walk fast, limits their ability to climb stairs, limits their ability to participate in the activities that they really love to do. And that's different for everybody. The younger a person is, the more we want them to try to get by without surgery, because we want to make sure that one knee replacement lasts their lifetime if we can. But occasionally you get a person who doesn't have that much pain that needs a knee replacement, because functionally they've become very impaired due to range of motion, or even wearing away the bone or stretching out the ligaments. And if they wait longer, then the subsequent knee replacement that they get is going to be compromised. And so occasionally we have a patient that's not that painful that we will do a knee replacement on.